So let's look at one of the pathologies that when you get a DMX with us that we mark and measure and compare to normals. First one is loss of the cervical curve. As you can see here on your reading left, that's what a normal neck looks like. Here's a static view from our DMX where we write they have a cervical kyphosis and what the percentage of loss is. We now have objective information. Now, big deal, what does that mean? So there's a lot of literature, and I just picked a couple out here. We could always go into this in more detail. In patients with a kyphotic deformity, neck's going the wrong way, the spinal cord shifts to the anterior portion of the spinal canal and abuts the posterior aspect of the vertebral bodies at the apex of the deformity. With the progression of kyphosis, the mechanical stress applied to the anterior aspect of the spinal cord eventually increases. In addition, dynamic forces caused by segmental instability, we can determine that on the DMX, which is often seen at the level of kyphosis, particularly in cervical flexion movement, contribute to compromised cord function. That was published in Journal of Neurosurgery Spine. Now, you have a loss of curve, big deal. It is a big deal. It can, according to this paper here and many, many others, it can literally irritate your spinal cord. This is something we want to identify and something we can fix. Here's a quick video I had made that shows a normal neck curve moving compared to a curve that isn't moving well. The green line represents the spinal cord, the blue is the discs, and as you can see, when we go through it, you'll see how with a normal curve, there's space where the curve is, and then when there's an abnormal curve, you'll see how there's tension on the ligaments, the discs, and that spinal cord ends up getting bumped. That can happen, and we want to know about that with the digital motion x-ray. Loss of curve and decreased blood flow to the brain. This is a paper that we also published as well in the Journal of Brain Circulation with some other authors. What we found was that an abnormal cervical curve, if we identify it on your DMX and imaging and we measure it, that it can also be linked to abnormal blood flow to your brain. Not a good thing. Here are some pictures from our study that on the top left is the vessels on the inside of the brain. On the right, when it's in red, we do what's called pixel intensity. Below on the bottom left, you'll see this is the same patient above, but they now have a normal neck curve. We put their neck into a normal lordosis, and what we found was that that increased blood flow up to 225%, or really an abnormal neck curve decreased blood flow. And in our office, we don't just say, you have a loss of curve. We don't just say, that's the way it could be. We implement a technique that can fix this curve. And here's a quick picture where we just dramatically improved the patient's neck, and we have lots of pre and post. We do a pre and post on all of our patients to show if there's an improvement.